Let me ask you a very simple question. At what age should you start screening for colon cancer? Most people think it is 60 or even 50, but these answers are now outdated. Doctors around the world are seeing something far more worrying, that colonic cancers are increasing far more in younger adults. Nearly 1 in 5 colorectal tumors are occurring in people less than 55 years of age, and that number is increasing. So because of this, most international guidelines now recommend to start screening at 45 years of age. For an average risk individual who has no family history of colorectal tumors or who has no history of any polyposis syndromes can start their screening at 45 years of age with a colonoscopy, which is the gold standard once in 10 years. For an individual who is at a higher risk, which include someone with a family history of colorectal cancer, inflammatory bowel disease with ulcerative colitis or Crohn's, hereditary syndromes such as Lynch syndrome or familial polyposis syndrome, the screening sometimes begins at 40 years or much more earlier depending on the risk. Remember that colorectal tumors take nearly 10 to 15 years to turn from a polyp to a cancer, and colonoscopy remains one of the most effective ways to detect these polyps and remove them at the same time during the procedure. That means that screening can not just detect cancer but also prevent it if done early. So if you are approaching 45, it is a good time to start your screening for colorectal tumors. I am Dr. Ajesh Saxena, cancer surgeon. Let's fight cancer together.